In this video, we're going to talk about top 10 most common health issues. So before starting this video, like this video and subscribe to our channel for future updates. Common health problems are the consequence of the disruption or alteration of the natural metabolic processes of the body, which can be caused by a pollutant, a virus, or another source. People who are unable to care for themselves on their own are eligible to receive personal health care services. The state of being emotionally, intellectually, socially, economically, and spiritually sound are all components of an individual's overall wellness, which also includes other aspects of life. Personal health problems can be caused by two different sorts of circumstances. Diet, lifestyle, and physical activity are all examples of the type that can be altered to lead to improvements in health. The second part, on the other hand, cannot be changed to control common health issues like genes, family history, or ethnicity. The majority of prevalent health problems. The following are some of the most typical problems that people have with their own health today. Number 10. A lack of physical activity. Maintaining a sedentary lifestyle is the contemporary world's leading cause of preventable illnesses and early death. A sedentary lifestyle raises the risk of developing cardiovascular disease and diabetes, as well as depression and irritability. In addition to this, premature aging is a side effect of sitting about for lengthy periods of time. Consuming foods high in nutrients and maintaining an active lifestyle, including regular exercise, is therefore crucial for healthy aging, as well as the prevention of diseases that can result in death. Number 9. Excessive body fat and obesity. Obesity is accountable for the numerous major personal health difficulties that are experienced by the 2/3 of the people in the United States who have been diagnosed with it. Overweight or obesity can lead to a number of serious health conditions, including hypertension, type 2 diabetes, coronary heart disease, stroke, gallbladder disease, osteoarthritis, sleep apnea, respiratory issues, dyslipidemia, and endometrial, prostate, and colon cancers. In order to manage obesity and give comprehensive advice for weight loss, the National Heart, Lung, and Blood Institute of the National Institutes of Health has developed these resources. Number 8. Tobacco. Tobacco addiction is currently the most prevalent health problem in today's high-stress society. In the United States, the excessive use of the tobacco is the major cause of lung cancer and the leading cause of mortality from lung cancer. According to the Centers for Disease Control and Prevention (CDC), former cigarette smokers who give up the habit are more likely to live longer, as they have reduced their risk of developing respiratory ailments and premature deaths. Number 7. Misuse of drugs and alcohol. The use of medicines as a treatment for mental health conditions such as anxiety and depression is another widespread problem among the world's population. The most frequent forms of the substance abuse are addiction, namely to alcohol and drugs. Addiction to this chemical may have serious adverse effects on one's health, including failure of the heart and kidneys, as well as neurological issues. Number 6. HIV, AIDS. 11 to 15% of all AIDS diagnoses in the United States are found to be in people over the age of 50. People who are over the age of 50 have a poorer immune system than those who are younger, which puts them at a greater risk of contracting AIDS. Because elderly people are less likely to use condoms and because their immune system weakens with age, HIV is more likely to be passed on to elderly people and to affect them. Regrettably, senior adults are underrepresented in research, clinical pharmaceutical trials, preventative measures, and intervention activities, all of which contribute to an increase in the number of people living with AIDS. Number 5. Conditions of the mind. The most widespread health problem is one of the mental health, which can deprive us of our hopes and ambitions. Problems with mental health might be brought on by adverse reactions to medications, difficulties with vision and hearing, infections, nutritional imbalances, diabetes, or any number of other health conditions. Depression is the most common form of mental illness that people experience in their later years as well as in their younger years. If depression is not treated in older patients, it might lead to death by suicide. This may come as a shock to you, but the rate of the suicide among older white men is higher than that of any other age group, even younger age groups like teenagers. Therefore, those who are near to you need to think about and pay attention to your own health issue. www.papsociety.org/xanax-alprazolam-1-mg/. Number 4. Falling and injuries. Among younger people, falls are the most common cause of injuries. Hospitalization for injury-associated trauma and death connected to injuries. Every year, one child under the age of 3 will hurt themselves by falling accidentally. Strength training, maintaining a healthy diet, and using certain medication can all contribute to an improvement in a person's overall health by lowering the risk of injury and falling. It's possible to lessen the likelihood of suffering an injury by taking precautions such as remodeling your dwelling, putting in place an alarm system, and putting in place safety measures against fire. It's been estimated that adults over the age of 65 have a mortality risk in a house fire that's 2 times higher than that of the people in other age groups. Number 3. Environmental quality. These days, poor environmental quality is a major contributor to a variety of personal health problems that people face. Because of how difficult it is to improve the quality of the environment, poor environmental quality is to blame for a large number of serious diseases and consequences. Even though pollution affects everyone, certain studies have shown that people with lower incomes, racial minorities, and ethnic minorities are more likely to live in areas with poor environmental quality. This results in a higher incidence of infectious and serious diseases. Number 2. Immunization. Both influenza and pneumonia are examples of common health problems that rank among the top 10 causes of death in people aged 65 and older. The importance of vaccinating older people against influenza has been emphasized, which has resulted in benefits. But pneumonia is still one of the deadliest diseases, especially for women and the elderly, who are more susceptible to its effects. Number 1. Availability of medical treatment. It's a problem that affects people's health all over the world. Most senior citizens don't give their health the level of attention it deserves. At the same time, there's been a shortage of geriatricians reported across the country, which leads to a delay in treatment and sometimes even prevents access altogether. Visiting the Urgent Way Walk-in Medical Center in New York, which open for business around the clock and provides patients with access to any and all medical services, is one way to solve the issue at hand. Individuals' overall well-being is connected to their own personal health concerns. There are several factors that influence an individual's health, such as their surroundings, body mass index, nutrition, and lifestyle. The most prevalent health problems are sedentary lifestyle and poor diets, obesity, harmful use of tobacco and other substances, AIDS, poor mental health, accidental falls and injuries, poor environmental quality, lack of immunization, and inadequate access to medical care. All of these individual health concerns need to be addressed in order to enhance your quality of life and protect you from contracting infections. Nobody could have anticipated the magnitude of the COVID-19 pandemic's effect on the job market and the public health sector. It's more important than ever before for people looking for jobs in public health to keep an eye on current health trends in order to inform their job search. Understanding the most prevalent health problems in the United States can help you make better decisions about your professional life, regardless of whether you already call the United States home or are contemplating making the move from another country to the United States. The question, what's the most serious public health issue today, can be an important part of deciding how to proceed with your career if you're trying to decide what path to take next. If you're considering a career in public health, it's important to be aware of the most pressing problems facing public health in the United States. This will help you better understand the areas that have the most room for improvement in terms of both education and services. When it comes to improving public health, providing direct patient care isn't the only way to make a difference. Jobs in other fields can also play an important part in reshaping the landscape of the public health. Working in food services and/or nutrition to assist people in gaining access to foods that are beneficial to their health is another way to assist in mitigating the most pressing public health concerns in the United States. These concerns can be alleviated by the development of technology that improves patient care, the implementation of public policies that make it simpler for citizens of the United States to receive the preventative care, and so on. It's essential to keep in mind that working as a medical doctor is not the only way to assist people who are struggling with the most common health issues in the United States. If this is something that interests you, it's important to keep this in mind. In order to better the health of the general population, a variety of professionals, including nurses, social workers, counselors, and policymakers, are all need to work hard. What do you think about this video? Do let us know down in the comments section below. If you want to hear from us again, make sure to hit the subscribe button before you go.